everyone, welcome back to my channel. Today I'm going to discuss further more about the good practice. I have already uploaded the two videos regarding one of the section of the good practice. Today I'm moving further on, and thank you for joining me today here. As we all know that you can go on the Cmpa website, you will come up to this page, any page, it doesn't matter. Then you have to go on educations and events, and you'll find the good practice link here. Once you open the good practice, there are multiple good practices here which you have to study for your Q1 exam, and it's very important because all the scenarios, all the questions which comes up, they are asking you something from all of these ethical parts, and it's, if you understand it very well, the the way they ask the questions and the answer they are looking for will be easy for you. As I mentioned, I have already done the professionalism before in my two different videos, as in part 1 and part 2, but you can look at that if you want. There is no connection between each sections as far as they are not in parts, but if you feel that, oh, you want to start something from the start, you can go check it out, the professionalism, and then you can come back to this one. Second topic of my today's is I'm going to talk about the boundaries. So I'll take the boundaries first, and then we'll move further on with this one. So I'm just going to click on that. And once again, thank you for joining and coming here to listen to the topic of ethical portion of the Q1. Let's get started. Boundaries. Preserving the therapeutic relationship by respecting professional boundaries. What are the things we think about when we talk about boundaries? Boundaries means either you are working in a team, you are working with the patient, you are working with your colleagues in a professional setting, in a clinical settings. There is a way that you can make a relationship. It could be a friendly relationship, it could be a personal relationship, it could be a professional relationship, it could be a therapeutic relationship. We are talking about therapeutic relationship with the patient. We can talk about professional boundaries while talking to the patients, building a therapeutic relationship. Even though you work in a team, you are having a team of attendings, nursing staff, and other healthcare aid, you always have to keep a boundary. There may be some people who can be friendly, but that doesn't makes that always come into the category of professional boundaries. So let's get started with this one. It's not pretty much vague. These are the only three guidance which we have to look for, and I'll be talking one by one on each of them. Okay, introduction. A successful physician patient relationship is built on trust. Consequently, physicians must ensure they are professional at all times and maintain appropriate boundaries with the patients. There is an inherited power imbalance that physician patient relationship, the dependency of the patients on the physician's knowledge and skills, the vulnerability they are experiencing as a result of disclosing sensitive personal information and submitting to the sensitive examination, and the fact that they, like anyone, are often most vulnerable when they are unwell, worried, undressed, all contribute to this imbalance. As a professional of healthcare, when we are talking to patients, we are building a relationship, and we always say that, okay, it's an equal relationship, it's a mutual understanding and mutual respect. But at some point of time, it's an automatic stage where your authorities or your dominancies comes the most, because you are dealing with a person who is already vulnerable for his disease, for his conditions, for being unwell, having some kind of sensitive information which he even does not give it to his family members. Let's suppose what kind of work they are doing. Maybe someone is doing some kind of work that increases the chance of sexually transmitted diseases. These kinds of things are very important, which are very sensitive and personal to everyone. But when they come to the clinic or in hospital to talk about their illness, they need to answer these questions, because they can understand that this is very helpful for us to find out the cause of the condition, the problems, root problems of that. So that's why they are always saying, even though we have an equal relationship as a physician and patient, we try to make an equal relationship, but dependency of the patients always comes on the physician. That's why there is an imbalance between physician and patient, and we always try our best to be professional and make a boundaries in that. Okay, even though I am having a high dominancy on our relationship, I will still involve you at each and every place while I'm doing the care. So that will makes you like a patient-centered approach, that we call as a patient-centered approach. Even though you know what to do, but you will still involve the patients Doesn't matter if patient doesn't understand, but you try your best to tell everything before you do any investigations or any treatment options or come up with any kind of conclusions which patients want, doesn't want. It's next step after that. So what is the boundary? Boundary is an accepted social, physical, logical space between peoples. Boundaries create an appropriate therapeutic distance between a physician and a patient and help establish role and expectations. In the simplest term, boundaries recognizes the inherited power differentials between a doctor and a patient and defines the limit of the therapeutic relationships. In the first paragraph we have been seeing like a physician is dominant at some point of time, patient is dependent on physician. Still we make a boundary and we try our best to keep that difference in a way that it's going surrounding by the therapeutic relationship. So that's why they are saying that boundaries is what, it's an recognizing that even though we have a difference in the power and it's inherited, you cannot change it, but you still make a limit. Establishing an appropriate therapeutic distance is important in all physician patients relationship, as it creates a consistency, predictable structures for how physician will interact with the patients. The most important thing in Canadian healthcare system is when you are working with the patient on a therapeutic relationship, you always try your best not to be more personal, not to try to expose your personal life to them or ask something which is personal to them but that does not relate to the care. So that means what the vacations looks like, what you did on vacation, that's none of our business. But the most important thing is where you went and did you have any kind of risk factors related to any kind of infections or any bites or something like that. So that's the boundaries which you have to make, and that comes what's the therapeutic relationship, what the boundaries looks like, how you can make it as a professional relationship rather than going beyond the personal relationship. And that's the only thing that makes us to create that kind of culture and that kind of practice that makes us to help to find out where our boundaries looks like, and how even though if a patient is coming to your personal space you can still make a boundary. But at this point of time they are more emphasizing on a physician is trying to enter into the personal space of the patient which is not related to the care, then you have to make a boundary and say okay fine, I don't need this type of information. So I'm going to start the guidance, which is uh, boundaries transgressions, number 1. Number 2 is respecting boundaries, intimate examinations. Number 3 is respecting boundaries, the slippery slope. So these are 3 different types of things, and they will discuss like few aspects of how the boundaries can be look like. And at some point of time in a life when a doctors know a patient from last 20 years, when the patients come into the clinic they don't have to formally introduce themselves, they just started chatting like informal chatting, or just started talking to something which is maybe their interests are similar like a sports or something. So that's kind of a thing, and in that situation then we need to know either we are crossing our boundaries, if we are violating our boundaries, or we are still in the boundaries while providing the care. Even though I know this patient from last 20 years, he lives in my community, I have seen him every day into the park or somewhere, either I'm being in the professional boundaries or no. So these are all the things which we will discuss in this one. Number 1 is some transgressions. Some regulated authorities college recognize 2 categories of boundaries transgressions. As this word mentioned, that we are talking about where we are trying not to follow the provided rules. So let's suppose number 1 is the crossing, number 2 is the violation. Violation is very extreme, but crossing it sometimes you were unintended cross your boundary, and they are usually benign, they are not harmful to the patients, not harmful to you, but you need to make sure that you're not crossing over and over and over again with the same thing. And it's not something which we call like being exploiting the patients or something, such as accepting baked goods from a patient to share to the office staff. Many boundaries crossings are well intentioned and have a therapeutic intention, such as when physician holds the hands of the patient who has reached out for support after receiving unpleasant news, or when a physician self-disclose a personal illness with the hope of helping the patients cope with the same illness. So what they're talking about is sometimes you are not crossing the boundaries. Let's suppose if a patient knows you for 5 years and she was being suffering from some kind of condition, you had treated her, she came up with the baked cookies. Instead of putting for yourself, you can tell them, okay, I'll accept this, but I'll accept this and I'll share it with my whole office staff. So that makes them that, okay, this is not something personal the doctor is looking for, it's going to be very general. So that's why they can accept it. And it's like a crossing boundaries, definitely, because we are taking something from the patients, but at some point of time, if you respect that, that's little good for the patient to build a relationship, rather than being rude and say, oh, we did not do it. Because baked cookie are not expensive, are not something luxurious, but at the same on the counteract, if patients come and give you a very luxury item, any kind of things which are very expensive, and if you accept that and you use that, that doesn't make a cross. That will makes you, because you are aware that it's very expensive, and if I'm using for my personal use, that could be something I'm violating at some point of time. And second thing is, in the second line, they are saying many boundary crossings are well intentioned. That means if physician is suffering from some kind of illness and you try to say, oh, don't worry, you'll get through this one, I had the similar conditions, or my family had the similar conditions and they go through this, it's very good to have a good prognosis and other stuff. So you're basically implying your own personal information in front of the patient, or you're giving some information of your own which should not be given. You don't need to refer yourself that you had this problem, your family had this problem, but but you're trying in a good intention, well intention, that that it's kind of a thing that might help the patients to cope up with the bad news or something. And the same thing happens with the example of a holding hands, because if you give an example of good bad news to a patient and he started crying, maybe you can put the hand on his shoulder, maybe try to calm him down or do something, or hold the hands. That some point of time is crossing, because you don't know either it was appropriate on terms of patient's culture, patient religious, patient is comfortable, or no, you don't know. But you won't ask, can I touch your hand, can I give you a hug. You just unintentionally do it because you think it's the best thing to do while patient is crying, or being in a shock mode or something when they got the bad news. So these kinds of crossings, even though you did not harm the patients, there is nothing harmful to you or to the patients, but still this is the crossing boundary, which is at some point of time are benign. Some point of time, if it goes over and over again, it might be violations. So second part is the boundary violations are harmful to the patients, or it's something which we can say should not be done, because it will make a trouble to the physicians, and it can exploit someone relationship and result from a failure to establish or maintain an appropriate limits in the physician's patient relationship. Let's suppose if you are taking baked cookies every week and you are booking an appointment for the patients, and you know that the patients will come and get the baked cookies, and you are using it for personal purpose, and you're not telling the patient, don't bring it again. I'm thankful that you think about me, but I don't feel that's a good idea to do that. If you don't tell them and they are coming with the same thing, and you intentionally trying to book them more frequently, that means you're violating. So it could be exploiting at some point of time, but at some point of time it's harmful, because patient will feel, oh, I'm giving him cookies every week, but I'm going this time without an appointment. Maybe he will give me a favor and see me as soon as possible. That means if he or she will feel that this doctor is going to give me a favor because I have been giving him cookies from last 3 weeks or something, and result from a failure to establish or maintain the appropriate limits into the physician's patient relationship. Sexual contact with the patient is always considered a boundary violation. Any kind of sexual contact, any kind of sexual relationship is violation. There is no way it can be crossing boundaries. It is always violation, but there are rules where you can You can make the sexual relationship, but you need to terminate the patient for specific time periods. Patient is not having any psychological support from you. Patient is not being treated for the mental health issues, kinds of things. This is a very different topic, but I'm just saying that it's not something you cannot make a relationship with the patient if you like him or her, but there is specific criteria in each and every place, and I think maybe province wise, that you need to understand before you try to build. Even the patient is not your patient anymore, still you have to follow some of the rules. So that's a different story, but any kind of sexual relationship, it's violations. There is no way of crossing. This is only directly go to the violation part. Excessive self-disclosures, giving or accepting inappropriate or elaborated gifts, probing for inappropriate or irrelevant personal information, failing to obtain consent for intimate examinations, failing to respect the patient's privacy, entering a business or financial relationship with the patients. Excessive self disclosure is also harmful because you are giving your own information which should not be given. Patient doesn't need your personal information, where do you live, what you do, what you eat, where you go for a vacation or something like that, for their care. So you don't have to do that. That's also violation, because you are trying to allow the patient to enter in your personal boundaries, and that might be at some point of time will be not good for that therapeutic relationship. And as I mentioned about gifts, if you are taking gifts, if you are giving gifts which are very inappropriate, let's suppose flowers or some kinds of things that can make a relationship, okay, it might go into the sexual relationship, it might go into the intimate relationship. So that's the problems comes here. And expensive gifts are also coming in this one. Probing for inappropriate or irrelevant personal health information from the patients, from the personal information, sorry, my bad. Failing to obtain the consent, this is very common. If you are doing a perineal exam, if you're doing an anal exam, if you're doing a breast exam, any kind of exam probably in which the undressing is needed, you need to ask the patients, can I go for it? Do you have a concern of this? Verbal consent is still enough rather than not taking anything. Respecting the privacy, definitely it's one of the violation. And entering into the business, this is very common, and you might see an example that a patients come to the physicians and they, oh, I'm financially struggling with it, I don't find a work, and physician will say, okay, you can come at my house and do some cleanings and other stuff and I'll pay for it. This is kind of a business relationship, this is kind of a financial relationship with the patient. Is not good. The other relationship is you try to invest into the company where a patient is there, or you're trying to basically funding your patients. These types of things are bigger picture, but the smaller picture is you'll find example of like patient is coming to you to do some cookings or cleanings and you're paying for that. That should not be done. Sometimes distinguishing boundary crossing from violations can be difficult. The fact that certain crossings may at times be therapeutically helpful contribute to creating a gray area between what is and what is not considered acceptable by medical regulated authorities. That's why this is, you never know what the crossing is, what the violation is, but the fact that certain crossings may at times be the therapeutically helpful contribute to create a gray area. Let's suppose if you say about your illness, that does not give a harm to the patient, but you try to create that boundary or you try to cross that boundary because you want to make a helpful contribution to that, and what is not considered acceptable by the medical regulated authorities. Indeed, successive boundaries crossing may create a slippery slope for transgressions that can unintentionally alter the nature of the physician-patient relationship over time and become boundary violation and can harm the patient. This is very interesting part, because when you feel like you're making some crossing examples over and over again, it's kind of a slippery slope. The more you try to do the same kind of a pattern with the same patients, or maybe in your practice, it became converted into the violation, and it doesn't shift from just from one crossing to the next crossing and your violations. No, it's like a slippery slope. The more you try to do that, the more slippery it will be, and the slope will keep going down and down and down until you become say that okay, now it's a boundary violation. So that's the one thing which they're talking about. That's why we should be very cognizant about crossing. Don't cross the lines which you should be throwing it maybe over and over again. Developing a mindful approach to the maintenance of appropriate boundaries may help avoid the slippery slope. That's why we are saying useful and mindful approach is very important. The key is to realize that when a boundary is crossed, there might be an accompanying degree of risk of harm, exploitations, or other detrimental effects onto the patients. The consequences of the patient well-being may be positive, welcome, supportive touch, neutral, sharing with the patients that your children go to the same school, or negative, holding a patient hand who is uncomfortable with it, thereby causing anxiety. Asking a patient, is this in the patient's best interest? When crossing a boundary may helpful way to remind yourself or mindful to this important principles. So this is very nice paragraph. It says you should be very mindful in approaching in terms of crossing any boundaries. Number one thing. Number two things, ask yourself, is it in the patient's best interest, or is it involved in the patient's care? If the answer is no, then you don't have to do it, because you never know what the consequences of that patients will be. You try to hold the hand because patients was crying, but patients will feel uncomfortable because in their religions it is not allowed. There's a man can touch them without their permission or something like that. So that's the same thing comes here. Just ask yourself, it's patient's best interest? No, don't do it. If it's patient's best interest, go for it. Then the reaction or the consequences of could be negative, could be positive, could be neutral, you don't know. But at some point of time, just ask us, so that will help you not to cross the boundaries while you are in a therapeutic relationship. Boundaries may be crossed or violated for many reasons: human kindness, holding a patient's hand in support; careless, not considering a patient history of trauma during an exam; misunderstanding due to the lack of attention or insight; calling a conservative patients who prefer to be addressed as Mrs. by her first name, or calling her dear; or rarely self-interest, using the relationship with the patients for financial gains can all play a role. To prevent misunderstanding and proactively foster a health professional relationship with their patients, it is helpful for physicians to reflect upon, devise, and universally follow a policy on whether and how they will engage with the patients, both in clinical setting and outside of it. For instance, on social media, socially within the community, regulated authorities, college policies on the matter should be informed standard of observe. So they are saying is how you can try your best not to cross it, at least, but maximizing your chances not to violate it. So let's suppose you become very careless. There may be some reasons that you are trying to cross it or violating the policies for many reasons. Human kindness, which is the one thing they're giving an example. Carelessness, you don't consider the patient's history of trauma or something while doing an exam. Let's suppose if you are doing an exam of the patient who has a femur fracture, you had a trauma history, but you need to uncover the patient's lower pants, then you should be asking about it. That kind of carelessness is important. Misunderstanding on the lack of attention, maybe a physician is burned out, they don't have insight, and call and they feel like, okay, she's always used to tell me to say Mrs. XYZ, and now today I'm calling her by dear, or maybe the first name, which they don't prefer. And there's self-interest, which is very rare, but if it can happen, it is also the crossing or violating. So that's why they are saying you should reflect upon yourself and make a universal rule for your own practice, because that will help you not to be specifically trying to feel like, okay, the approach with this patient will be different, but the approach with this patient will be different, because this patient is fine with if I'm touching her or doing an exam or something, but this patient is not fine, so I have to involve her. You have to treat each and every with the same respect and same kind of treatment options, and your professional boundaries should always stays the same with each patient. So this was the part one of the video. I'm going to make the part two, in which I'm going to talk about intimate examination and as well as the slippery slope. Thank you for checking out this video. If you like it, please share, subscribe, and let me know if you need anything else from the Cmpa website, and I will try my best to make the video on that one. And I hope this kind of reading will be helpful for your QE1 preparation. Good luck everyone. Thank you so much and have a great day.